Hi, Ivy. Welcome in today. How are you doing?
Hi, Dr. Kate. I'm okay.
Can you tell me a little bit about what brings you in today?
Yeah, I've just been noticing that I've been feeling like a little bit tingling sensation on my scalp, a little bit of numbness at times as well, and I've just been having some migraines or pretty bad headaches lately.
Okay, and how long have you noticed this going on for?
I think it started probably like 2 weeks ago, but at first I just thought it was a migraine. I do get them maybe once a month usually.
Okay.
But it's happened a few more times and it's not normal.
Yeah, okay. All right, thank you for letting me know all of that. I'm going to go ahead and start our examination today. We're going to be doing a scalp as well as a neurological exam to really get to the bottom of why that tingling and those headaches could be happening.
Okay.
If you can just sit back and relax, I'm just going to put on my gloves. Okay, Ivy, first I'm going to begin with some palpations of the scalp, feeling for any masses or lumps that could be hiding underneath the skin. Okay, I'm not feeling any lumps underneath the skin at all. I'm going to continue with a visual inspection of the scalp. I do have my light here. I'm just going to be moving aside the hair follicles to look at the skin of the scalp. Okay, I do see a bit of dryness, a bit of irritation. I'm going to go ahead and take some samples. There does seem to be a little bit of dryness and flakiness right over here. I'm just going to go ahead and scrape off some of those flakes to take a sample of. Okay. So we're going to go ahead and run that through our labs. Now we're going to be moving on to a sharp or dull test of the sensations in the skin. We're going to be pressing an object into your scalp. That object is either going to be sharp or dull. Here's an example of what sharp will feel like. Here's an example of what dull will feel like. Just let me know if what you feel is sharp or dull.
Sure. Dull. Sure. 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 Dull. Sure. Sure. Dull. Sure.
Okay, next I'm going to use my tuning fork. I want you to let me know if you can feel this vibration.
Yeah.
Go ahead and let me know when the vibration stops.
Stop. No. 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 No.
Okay. I'm going to go ahead and press some acupuncture tools into your scalp. I want you to let me know if you feel this on the right side, in the left side, or both.
Right. Left. Right. Right. Left. Right. Both. Left. Right. Left. Right. Both. Left. Right. Right. Both. Left. Left. Right. Right. Both.
So you've passed all of our tests today with flying colors. I do notice the irritation that I mentioned to the scalp earlier. We're going to start by going ahead and adding some moisture to the scalp. I have some drops of scalp oil here. I am going to be adding them into the hair and then massaging them through.
Okay. Thank you.
Okay, Ivy, that concludes our scalp examination and treatment for the day. We are going to need to do some further testing to determine the cause of your loss of sensation in the scalp, but we went ahead and rehydrated the scalp today as well as exfoliated it and really worked that oil into the scalp.
Okay.
How are you feeling now?
I think I feel better. Okay. The headache's gone.
Okay, that's a good sign. I'm going to go ahead and schedule you another appointment so that we can do some further testing, and hopefully it won't bother you as much in the meantime.
Okay. Thank you so much.
Thank you. Hi, welcome in, Katie.
Hi.
My name is Dr. C. I'm going to be taking care of you today.
Okay.
Tell me a little bit about what brings you into the clinic today.
I'm having a lot of foot pain underwater, and I switched to a new pair of shoes a few months ago, and they seem to be working really well, but it just kind of came out of the blue. I've been running more, so that's been resulting in some blisters on my toes and feet. And I've also had a few social events I've gone out to and worn kind of crazy shoes, and this is kind of bringing some wear and tear in my feet, so I'm feeling pain, and then I have some skin issues too.
Okay, that definitely sounds like something that you should be a little bit aware about, so it's a good thing that you came in today. And you said you've been noticing this pain for a few months now?
Yeah, the last month or so, I'd say.
Are you concerned about this being anything other than the blisters and the pain? Is there any underlying pain? That doesn't seem quite usual.
I don't think so. I don't feel any like sharp pain. Like it's not excruciating. It's just really, really sore and uncomfortable, and sometimes it hurts to run. So,
okay.
Yeah.
Have you considered taking a break from running for a bit?
Not yet, but I will if that's your determination.
Okay. And just to go ahead and add some things into your chart here, what is your date of birth?
Sure. It's March 24th, 1988.
And have you taken any medications within the last 6 months?
No.
Have you had any major surgeries within the last 6 months?
No.
Any trips outside the country in the last year?
No, unfortunately.
Okay, Miss Katie, we're definitely going to go ahead and take a look at you today, get to the bottom of what's been causing your pain.
Okay.
For now, you can go ahead and relax. I'm just going to go ahead and do your blood pressure and your vitals.
Okay. Great.
We also have our little emotional support kitty Enzo here if you are
Thank you.
looking for a good boy to give some loving.
Okay.
Okay. Go ahead and relax. I'm just going to start off by taking your temperature. Okay. We have 98.6 as your temperature. Now we're going to go ahead and check room. What am I trying to say? Room oxygenation?
Oxygenation, yeah.
Okay. Now we're going to take a look at your oxygenation. If you go ahead and slide your finger in there and let it rest. Now we're taking a look at that. I'm going to go ahead and slide this here. Give this to clinical assistant Enzo to hold on to for a moment. Go ahead and uncross your legs for me. Okay. do have a healthy reading today. Good. Go ahead and set these aside for now. Okay, as for oxygenation, we have good readings on room air. That's a good sign. Just going to mark this into your chart. For now, all I can do is instruct you to pet the good boy as part of your treatment so far.
And then we'll do that gladly.
Okay. That marked in. I'm going to go ahead and take a look at the structure of your knees.
Okay.
If you wouldn't mind just sitting as you are with your knees extended over the sides of the bed there. Okay, Miss Katie. Just going to go ahead and feel the structure of your knees to make sure that the joints here aren't creating any tension that would lead to the foot pain.
Okay.
Just feeling structurally intact. I'm going to go ahead and try a little bit lower from your calves, making sure there's nothing tense or pulling while the feet are in rest. Does this cause you any pain?
No, not really.
Okay. Go ahead and check your reflexes really quickly. Okay. Everything seems to be intact with the knees so far. I'm going to ask you to raise your left leg. Good, and relax. And raise your left foot. And relax. Okay, same on the other side. Go ahead and raise the base leg. Great, and then raise the foot. Everything seems to be aligned. This doesn't seem like the source of the pain, which is a really good sign. I'm going to go ahead and ask you to lie down, and I'm going to take a look at your feet.
Okay.
Okay, Miss Katie. Just going to go ahead and gently roll up your pants. Okay with you if I remove your socks? I love your nail polish.
Thank you.
Okay. Just going to begin by gently palpating the feet, as well as conducting a visual exam. Okay. Any pain in the tips of the toes?
No.
Okay. Does this hurt at all?
A little bit.
Does this hurt?
No, just a little irritated.
Gotcha, I do see a little bit of signs of some blistering here. Most likely from the running that you mentioned. Okay, I want you to point your foot on your right foot as far as it can go. Great, and bring it back as far as it can go. Go ahead and just draw your toes up towards your chest if you can. Great. Now go ahead and point with this left foot. Okay, and relax. I see a little bit of scarring over here. Have you had a surgery on your foot in the past?
Yes.
Okay. Okay, Beauty, go ahead and continue to relax. I'm going to go ahead and measure different parts of the feet so that I can compare the swelling between them. Okay. Okay, I'm going to have you gently raise this foot a tiny bit just so I can go ahead and measure the ankle. Okay. And we'll switch back here. Okay, go ahead and raise your foot up a tiny bit. So it does look like the right foot is definitely more inflamed than the left foot. For now, I'm going to go ahead and position your ankle to do some rotations. Be gently rotating each foot in a circle. Go ahead and just relax. This might cause a little bit of pain and discomfort, but I'm just checking out the joints in the feet. Now they move together. Just going to raise up your leg and rotate your foot in a circle. And move over to this foot. Raise this foot up, gently rotate it. Okay. Can you go ahead and spread your toes as far apart from me as you can? Great, now relax. I'm just going to go ahead and use my hammer to feel along the bones of the foot. I'm just going to gently run this along the underside of your foot to test the reflexes. Okay. I'm going to go ahead and do some measurements. ahead and do visual inspection between the toes, underneath the nails. Okay, Katie, I am going to go ahead and conduct a sensory exam on your feet.
Okay.
The first one is going to be either warm or cold.
Okay.
Just let me know if the sensation that you feel is warm or if that sensation is cold.
Cold. Cold. Cold. Cold. Warm. 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 Cold. Warm. 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 Cold. Cold. Warm. 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 Cold. Cold. Okay. Now we're going to be switching over to sharp or dull. This is what sharp is going to feel like. This is what dull is going to feel like. Do you notice the difference between those two sensations? Yes.
Okay.
Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Alrighty, Katie, now we are going to do left or right. Right. Left. Right. Right. Left. 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 Right. Left. Right. Alright, Katie, pass all of these tests with flying colors. I'm going to do a bit of acupuncture therapy next. We're also going to be rubbing your feet with some lotion and some soothing oils, so hopefully this is going to be easing the pain that you've been having. Okay, thank you. I do have a nice and soothing eucalyptus massage oil. Just going to be gently dripping this onto the feet. Alright, Katie, I'm going to go ahead and have you switch onto your stomach. Okay, I'm going to be applying some acupuncture pressure into the soles of the feet. We do have a massage roller that has been dipped in rose water essence. to help heal the skin and the muscles and tendons underneath it. I have the squash out training. Lastly, I do have a bit of lotion. Alrighty, Katie, that does conclude our examination for the evening. I definitely like what we've discovered so far. It doesn't seem like anything majorly is going on wrong with your feet, but we are going to go ahead and schedule you a follow-up appointment next week so that we can go ahead and run some further testing.
Okay.
Thank you so much for coming in today.
Alright, good night.
Good night. Hi Sydney, welcome into my office today. How are you doing?
Okay.
Good. Thank you so much for coming in. I do have your patient chart in front of me. Before we begin, I'm just going to ask you to verify your first name and your date of birth.
Sydney, May 10th, 1998.
Sydney, and what brings you in today?
I've just been really tired lately. I'm fine when I lay down, but as soon as I start to get up or stand, I get really dizzy.
Have you been more sleepy than usual? When did you first start noticing these feelings?
It's been like a week.
Have you tried any over-the-counter medication?
Just like a sleep aid, like melatonin.
Gotcha. Have you felt any more nauseous than usual?
No.
Okay. Does it get better at all if you lay down for a bit of time or if you eat something?
Eating helps. Definitely if I'm like, after a long period of rest, I can be okay for a little bit.
Gotcha. And I'm just going to go ahead and ask you a few basic questions just to update your chart here. Have you been out of the country in the last year?
No.
Have you had any allergies develop in the last year?
No.
Have you had any major surgeries in the last 6 months?
No.
Okay. Alrighty, Sydney. I'm going to go ahead and start with my exam. We're going to be doing a cranial nerve exam today. I'm going to go ahead and keep you laying down so that you don't feel too dizzy or overwhelmed. So you can just feel free to relax and let me take care of you.
Thank you.
I'm going to set this aside. Okay. First start off by taking a listen to your heart and your lungs. Go ahead and move your shirt just a tiny bit just so I can press it into the skin. Okay, I'm going to go ahead and take a listen to the lungs. Take a deep breath in for me. And out. And in. And out. Great. Everything sounds healthy as far as the heart is concerned. No murmurs. I'm going to go ahead and conduct a blood pressure test. I'm just going to go ahead and wrap it around this arm if you wouldn't mind freezing it a tiny bit so that I can get this one out. Go. I'm going to ask you to go ahead and extend this arm, but you can just leave it at your side here. Okay. brush has a normal reading today, which is a good sign. I'm going to go ahead and slip this off and set this aside. Now I'm going to go ahead and check your oxygenation level. I'm just going to go ahead and place this on your fingertip. Let that rest for a moment. And move your pen slightly to check your temperature. We have 98.6. There's a great sign there. Go ahead and set this aside. Take a look. Okay. We have a solid 97, which is another great sign. Go ahead and remove this. Now I'm just going to go ahead and take a look at your face. You can go ahead and relax. I'm just going to be running this light over the skin, making sure that there's no concern, lumps or bumps or bruises. I don't see anything of concern. Go ahead and take a feel with my hands on your head. Just making sure that there are no masses under the skin. Okay. Everything feels fine and normal. Just to be sure though, I'm going to go ahead and take a few measurements at the head for our documents. You can go ahead and continue to relax. Do the point of the forehead, measuring down to the chin. Okay. Measure the distance between the brows and along the brows. Measure the length of the nose and the chin going down to the collarbone. This is to check for any swelling as I compare different sides of the face. Okay. Everything is looking really symmetrical. There's no signs of any swelling in the face. So we're going to go ahead and move on to more of a sensory exam, as well as checking the different vital signs. I'm first going to go ahead and start with the ears. Alright, so now I'm going to ask you to turn to your left side. I'm going to go ahead and look into your this right here. Don't see any kind of swelling and discharge or excessive hardness. Not really relaxed, not too much. I'm going to ask you to turn towards me and take a look in your other ear. Okay, looking at the same situation on the side. Nothing too weird of concern. Everything is looking healthy. Now I'm going to go ahead and conduct a baby hearing test. I want you to go ahead, you can face up and close your eyes. to have these two shaker tools. I want you to let me know if you hear this on the left side or the right side or on both sides.
Left, right, both. Left, right, right, left, right, right, left, left, both, right, left, both.
Alrighty, now I want you to let me know if the sound that you hear is near, like within a, 12-inch radius, or if the sound is far, basically farther than a foot away.
Near, far, near, near, far, near, far, far, near, near, far, near, near, far. Okay. Now go ahead and take a look inside your nose. Go ahead and just hold still. I'm just going to be shining your right inside. Great. I don't see any kind of redness or swelling. Everything's looking normal and healthy. Have you noticed any problems with your sense of smell lately? No.
Okay. I'm going to have you close your eyes. I'm going to go ahead and hold up 2 different vials for you. When I tell you to go ahead, I'm just going to have you inhale and you're going to tell me what the scent is that you smell. Okay. And inhale.
Floral.
Okay. I'm going to do the same thing. But I'd like you to cover your left nostril. And inhale.
Vanilla.
Yeah. Great. And we're going to do one more. But you're going to cover your right nostril. Good. Okay. And inhale.
Cinnamon.
Okay. Now we can go ahead and take a look inside the mouth. Go ahead and hold out your tongue and say, Great. The throat looks healthy. The teeth and gums are looking healthy. No signs of excessive redness or swelling. Have you had any problems with your sense of taste lately? Not that I've noticed. Okay. I'm going to have you hold out your tongue, and when I hold up this dropper, I'm going to just release a drop onto your tongue, and you're going to let me know what it is that you taste. And
Sour.
gotcha. Go ahead and do 2 more. And sweet. Great. And one final one. And there.
Bitter. Great.
It doesn't seem like there's any kind of issues with your sensitive taste, which is a good sign. I'm going to go ahead and continue on. We're going to take a look at the eyes. Go ahead and look straight at my nose here, and I'm going to just shine this light into your pupils. Okay, pupils are round and reactive to light. Have you noticed any problems with your eyesight lately?
No, but I haven't gotten tested lately.
Okay. I'm going to have you use your left hand here and hold this as far away from your face as you can. I'm just going to go ahead and take this little pointer here. I'm going to use your right arm to cover your right eye. Would you please read this row starting from the right and moving towards the left?
O-C-T-P-E.
Okay, great. I'm going to have you read this row starting from the left and moving toward the right.
L-T.
I'm going to read this row starting from the left and moving towards the right.
D-H-J-B-S.
And what letter is this?
H.
And what letter is this?
F.
What letter is this?
E.
And what color is this?
Red.
What color is this?
Green.
Great. I'm going to have you switch the arms versus the eyes. Okay, I'm going to have you read this row starting from the right and moving towards the left.
F. C. L. O.
Great. I'm going to have you read this bottom row here starting from the left and moving towards the right.
L. T. F. P. H.
I'm going to have you read this row starting from the right and moving towards the left.
F. C. L. O.
What letter is this?
T.
What letter is this?
C.
Which letter is this?
L.
What color is this?
Green.
What color is this?
Red.
Let me take this from you. Now I'm going to just hold up some fingers with the number. I'm going to hold up my hand with the number of fingers raised. I want you to tell me how many fingers that you see.
2, 5, 1, 3, 4, 1, 2, 5, 3, 4, 5, 2, 1.
Okay, great. It looks like your eyes are functioning well and in good shape. I'm going to go ahead and move on. I'm going to go ahead and take a look. It looks like your senses are functioning pretty well. I'm going to go ahead and dive a little bit deeper. I'm going to just ask you to relax your face. I'm just going to gently hammer along the bones to see how the skin and the nerves are reacting as well as the muscles beneath. Okay, everything seems to be reacting correctly, accurately. Go ahead and gently touch the side of your face with this tool. And it will let me know if I'm touching you on the left side of your face, the right side of your face, or the center.
Right. Center. Left. Center. Right. Right. Left. 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 Right. Right. Center. Left. 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 Right. Right. Center. 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 Right. Left.
I'm going to go ahead and move on to sharp or dull. So this whole concept, I'm going to go ahead and press one of these objects into your skin. You're going to let me know if the sensation that you feel is dull or if that sensation is sharp. Do you notice the difference between those two?
Yes.
Okay.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Alright, Alrighty, Sydney, I'm going to warm versus cold. This is an example of what the cold is going to feel like. And the warm is just going to be the warmth of my hand here. Do you notice a difference between those two sensations?
Yes.
Okay, great. I'm going to have you close your eyes and let me know which sensation you feel. If it is warm or if it is cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. 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 Warm. 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 Cold. 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 Alright, Sydney, that does conclude our examination for today. All the results that came back were normal. You definitely have an accurate sense of taste and smell. You can see perfectly well. Your hearing was good. The sensations test came back normal as well. You were able to detect between the warm or the cold and the sharp or the dull. It still doesn't explain, however, the dizziness and the symptoms that you've been feeling. So what I'm going to go ahead and do is prescribe to you some medication that's going to hopefully help with the dizziness. I would also like to see you again in a week to hear if that medication was effective, and also so that we can do some further testing. Does that sound okay?
That sounds great. Thank you.
Okay, my pleasure. I'll see you again next week. Thank you. Hi, Matt. Welcome in today. How are you feeling?
I'm okay.
Okay. I'm just going to go ahead and start off our appointment today by verifying your first name and your date of birth.
Mad P. ASMR. That's ASMR. And June 2nd, 89.
Okay, Matt. Tell me a little bit about what brings you in today.
It's been about 3 years since my last checkup.
3 years? Okay.
And I am having a little bit of pain in the back, especially on the right side.
Gotcha.
Sometimes I just wake up with it, and it goes away throughout the day, especially after I eat.
Okay. How long have you been noticing this pain?
For about 2 weeks.
Have you had any changes in medication?
No, I'm not taking any medication.
Gotcha. Have you had any recent surgeries in the last 6 months?
No.
How's your sleep been?
Well, the pain, it's kind of bothering me at night.
Okay.
So I would say I'm tossing and turning.
All right. Have you developed any new allergies in the last 6 months?
No.
Have you had any other health concerns or anything on your mind?
No.
Okay, Mad, I'm definitely going to get to the bottom of that pain today. Because it's been so long since you've had your last physical, we are just going to be doing a general head-to-toe assessment, as well as checking the nerves, making sure everything is properly functioning. I'm going to go ahead and put on my gloves, and then we're going to do our blood pressure test.
Okay.
You can go ahead and relax. Is this arm okay to conduct our blood pressure test on?
Yeah.
I'm just going to ask you to gently just extend your arm for me right here. I'm going to ask that you uncross your legs, please, for this next section for the blood pressure test. And go ahead and just lay your arms still and relaxed. You do have a normal blood pressure reading today, which is a good sign. I'm going to go ahead and gently remove this from your arm. Just going to roll this up and set this aside. Just going to be marking down your results. Blood pressure is going to be 120/70. Okay. Now for this next section of the exam, I'm going to ask that you lie down here with your head on this headrest, face up.
Okay.
Okay, Matt, go ahead and relax. Are you feeling comfortable in this position?
Yes.
Great. First, I'm going to just use my gloved hands, gently press along the face, doing gentle palpations of the lymph nodes. Feeling for any kinds of swelling, any lumps or bumps that are resting beneath the surface of the skin. Does this cause you any tenderness?
No.
I'm not feeling any swelling or any raises to the skin. Just going to draw my hands up along the forehead, down the cheekbones. If feeling how the muscles sit beneath the skin. Okay, everything is feeling nice and healthy so far. I'm going to go and grab one of my tools to take a look at your hair. Switch this out. Okay. Just going to be doing a brief scalp inspection. My light here. Just making sure that I don't see any signs of lice or ticks. The hair is looking nice and healthy. The scalp is even in color. I don't see any raises or bumps. Okay, everything is looking healthy. No signs of any dandruff or any other areas of concern. Just going to finish it off with a little inspection of the forehead. And I'm going to be taking a look inside your ears. If you wouldn't mind just turning your head, yep, just a little bit to the left. I'm just going to gently insert this and take a look around. Okay, everything is looking healthy. No signs of any drainage or discharge. The skin inside the ear is looking healthy and clean. Just going to go ahead and just to take a look inside your ear. Okay. It's looking very similarly in this ear. No signs of any drainage or swelling. No signs of any discharge. You can go ahead and relax your head. Have you noticed any changes to your hearing in the last 6 months? No. I'm going to have my tuning fork here. Let me know which sound is louder in position 1 or position 2. Position 1. Position 2. 1. We have position 1 and position 2. 2. One more time. We have position 1, position 2, 1. We have position 1, a rain stick here. I want you to let me know which side you hear the noise on the right or the left.
Okay.
Right.
Left.
Right.
Left.
Now we're going to try that with a more subtle sound. I'm just going to be moving my fingers in a snapping motion. I want you to let me know if you hear this on the right side, the left side, or both.
Left. Right. Both. Right. Right. Left. Both. Right. Left. Left. Both.
And I'm just going to be taking a look inside your nose. I'm just going to get closer here. Okay, everything is looking clear. No signs of obstruction. No signs of any discharge or drainage. Okay, the same with the nostril. Everything is looking clear and healthy. Have you noticed any changes to your sense of smell in the last 6 months?
No.
Okay, I do have a scent kit here that I'm going to be choosing a scent from to make sure that you have an accurate sense of smell. Okay. I'm going to hold down one side of your nostril and then ask you to inhale strongly with the other on the count of 3. 1, 2, 3.
Parsley.
Okay, do the same on the count of 3. 1, 2, 3.
Dill.
And I'm going to do it a third time without holding down either nostril. On the count of 3. 1, 2, 3.
Cilantro.
And then I'm going to ask you to turn your head towards me, open your mouth, and say ah as I take a look at your tongue. Okay. Everything is looking healthy inside the mouth. No signs of any redness or swelling. The tongue looks healthy. Have you noticed any changes to your sense of taste in the last 6 months?
No.
Now I have 2 droppers here. going to ask you to close your eyes, hold out your tongue. I'm going to just drop a tiny droplet onto the tongue. I want you to tell me what you taste. Okay, on the count of 3. 1, 2, and 3.
Ginger.
One more. On the count of 3. 1, 2, 3.
Turmeric.
I'm going to ask you to look directly at the ceiling mat. I'm just going to rise out of my chair and take a look at the pupil. Everything is looking clear and healthy. No signs of any abnormal reflection. No signs of any obstruction. Just going to take a look at this eye. Pupils are round and reflective of light. Now, I'm going to be just testing out your vision here. I do have some colored cards that we're going to be going through. Each card has a picture on it. I'm just going to hold up this deck right here. Now, what is this drawing that you see?
Looks like a pancake.
Okay. And what color is this sheet of paper?
Blue.
Now, what is the drawing that you see?
Train. Train track.
Okay. And what's the color of this page?
Yellow.
And what is the drawing that you see here?
Caterpillar.
And what color?
Orange.
And what is the picture that you see?
A leaf.
And what color is this page?
Purple.
What is it that you see?
An eye.
Okay. And what color is this page?
Pink.
I also have some cards here that have some words on them. I'm just going to ask you to softly read the word and just say the word out loud that you're reading.
Okay. Playing. Whispering. Running. Brushing. Jumping. Playing.
Okay, Matt, I have two new tools with me here. I'm just going to be performing this along your arms, around the neck and the face area. We do have a sharp tool. This is what the sharp tool is going to feel like on your arm. This is what it will feel like on your face. And this is what the dull tool will feel like on your arm versus your face. Do you notice the difference between those two sensations?
Yes.
Okay.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 dull, dull, sharp, dull, sharp, sharp, dull, sharp, sharp, dull, dull, sharp, dull, sharp.
Okay. Thank you. Yeah, I'll do it too. Alright, Matt, now we're going to do warm or cold. This is an example of what warm is going to feel like with my fingertips here. And this is an example of what cold will feel like with the tuning fork. Do you notice the difference between those two sensations?
Yes. Cold. Warm. Cold.
So I'm just gonna take this off.
Warm. Cold. Cold. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm. Warm.
Alright, Matt. I'm going to ask for you to rotate onto your back, onto your stomach, so we can take a look at your back.
Okay.
Okay, Matt. I'm going to start moving my hands down the spine in gentle position. I'm not feeling any extreme signs of curvature that could indicate any scoliosis. I don't feel any signs of swelling. Don't feel any lumps or masses beneath the skin. Just going to be gently using my hammer to feel the vertebrae. As well as the ribs.
muscles. I'm just going to be doing a gentle swabbing of, just to make sure there's nothing harmful. Just gently scraping my tool here across the surface of the skin and modeling it. Making sure that both tubes are even. Okay. Now I'm going to make sure there's no signs of any danger or any signs of flakage along the skin at the back. I'm going to be listening in to the lungs. Alright, Matt, I'm going to have you take a deep inhale for me and exhale. And another deep inhale and exhale. Another inhale and exhale. Okay, 3 more times. Go ahead and inhale and exhale. And inhale and exhale. 1 more time. Inhale and exhale. Okay. I'm going to be using my sharp tool here to run it across the skin at the back and see how the skin reacts if the skin doesn't jump back up from where the tiny spikes touch it, or if there's any signs of excessive redness. Neither of those look like they are the case, which is definitely a good sign. Okay, Matt, I'm going to have you flip around and I'm going to take a look at your abdomen. Alright, Matt, I am going to gently press into your abdomen, making sure that there are no unusual formations resting under my touch. Now, you mentioned the pain on the right side. Do you feel that pain now?
It's, yeah, somewhere around here.
Okay, just going to do some gentle proddings. In this area, I can tell that there is a bit of swelling compared to the other side. Okay. I'm going to go ahead and measure that swelling. You can continue to relax for me. Just going to measure across. Just going to take a look from hip to hip. Okay. Let's do. Okay. question. I definitely do notice swelling. I don't feel anything with my fingers besides the swelling. You can just breathe normally. I'm just going to be listening to the sounds of the stomach. The fact that I can't feel anything with my fingers is a good sign, and the noises of the stomach were definitely all normal. We are going to have to do some further testing and analysis on this area, but for now I'm going to go ahead and have you sit up and we can discuss the results.
Okay.
Alright, Mad. I'm really glad that you came in today. Thank you. Alright, Matt, I'm really glad that you came in today. We definitely discovered a lot. Most of your results were completely normal, which is definitely a good thing. I've noted that in your chart here. I can't really explain the pain in your abdomen at the moment, but we are going to go ahead and schedule some further testing for later in the week if you're available then.
Yeah.
I have gone ahead and recorded everything that we discussed today.
Okay.
And I look forward to uncovering more of the answers about why you've been feeling the way you've been feeling.
Thank you.
Thank you. I'll see you again soon, Matt.
Okay.
Hi, Cardinal. It's so great to see you today. I'm so glad that you're back in for another session with our massage therapy. I'm going to go ahead and put your hair back, and then we're going to get started. I know that you mentioned that there's been some neck pain and some shoulder pain that you've been dealing with recently, especially because you've been hunched over for your job drawing. So today we're going to take a special focus on your neck and shoulders. You can go ahead and relax. I'm just going to put your hair up before we get started. Go ahead and relax. I'm just going to take off your necklaces. Okay, Cardinal. your back. Start getting a feeling for how the muscles and as they stand. Definitely feel right here where the tension is. How's the pressure here? Perfect. Really going to target the muscles in our neck and shoulders. We are going to go ahead and start off with some cold roller therapy. I'm going to squirt some oil. It's eucalyptus massage oil. I'm going to massage that in with our cold roller. Okay, Cardinal, we're going to be resuming our work with the cold rollers. This is going to be a bit cold. Okay, Cardinal. I'm gonna put a bit of oil here on your chest. Cardinal, I'm going to ask you to turn your head to the left. I'm going to use the gua sha tool.
You know those chunkums need attention. Can I have your face on your right side now?
Okay, Cardinal, that concludes our 30-minute session for this evening. How do you feel?
Great. Thank you so much, Dr. C.
My pleasure. I'll see you again soon. Enjoy the rest of your day. Hi, Andrea. Welcome back. It's so good to see you again. You're looking so radiant and gorgeous this beautiful night.
Thank you.
I understand that I'm going to be doing your makeup for the rest of your night this evening. Tell me a little bit about what you have planned.
Just a dinner date with my boyfriend.
Okay, fun. Is there a certain look that you're going for?
Simple.
Okay. Are you going to like a fancy restaurant, more of like a bar?
A bar.
Okay, fun. I'm like building a picture of your night already. I think I'm gonna go ahead and frame your gorgeous eyes, and we're just gonna go ahead and go from there.
Sounds good.
I'm gonna go ahead and do a little bit of skincare first. So I'm gonna brush your hair, put the headband in, and then go ahead and give your face a wash.
Awesome.
Great, go ahead and relax. I'm gonna go ahead and get started. Your hair is so nice and soft. I can tell it's very well cared for. I'm going to be really gentle with the brushing, starting gently at the ends and slowly working upwards.
It's very relaxing.
I'm glad you feel like that. I'm also relaxed doing it, so it's a win-win. We have some nice rain in Chicago ambiance in the background, so this will be nice and relaxing for you. Just gonna gently brush the hair back along the scalp. I'm going to go ahead and put this headband in. How does that feel?
Perfect, thank you.
Okay, great. Alrighty, Andrea. Go ahead and continue relaxing with our kitty friends here. Looks like there's an exciting bug in the window. I do have a tea bag here with some hot water. It's butterfly pea powdered tea, so I'm just going to be dabbing it in the water here, infusing the water with the healing herbal remedies of the tea to help transfuse into the skin. The water should slowly begin to move from clear to light blue as the tea bag infuses. Just gently infusing the tea bag. Okay, I'm going to leave that to infuse a moment. I'm just going to go ahead and use the corner of this cloth to gently soak into the tea infused waters. I'm just going to gently wring out the water and use this cloth to gently dab into your skin. Okay. Just gonna rub in a tiny bit of hand sanitizer into my clean hands here. I do have this Hydro Boost exfoliating cleanser. I'm just going to remove any lingering dead skin and hydrate and nourish the face. I'm just going to froth it up in my hands here and then gently apply it to your cheeks. I'm using nice, gentle, circular motions to help soothe the skin. Okay, I'm just going to add a tiny bit more to the forehead. I'm using a lot of care and gentleness when touching the face, as not to irritate the skin in any way, and also to help transfer my good energy from me to you. Now the water has a nice dark coloration. And gently bring this cloth up. going to gently dab this cloth onto the skin of your face, rubbing gently just to absorb any of the excess moisture. Taking care to be nice and gentle with the skin of the face. You have really nice soft skin, so I want to make sure it stays hydrated. Alrighty. Now I'm moving on to this glowing vitamin C serum. I have a bit on my fingertips here. Just going to gently pat. And I'm just going to very gently rub it into the skin. Making sure to bring it down the neck as well. Alrighty, Andrea, I'm going to go ahead and put this under eye serum really gently with my forefingers here, right into the under eye area to add some extra moisture. Just really gently rubbing it in. Okay. Now I'm going to go ahead and move on to the makeup section of our journey here today. I'm just going to really gently dab this concealer a little bit into the under eyes and the T section. Your skin is so clear you do not need concealer, but I'm just going to go ahead and even out the skin tone a tiny bit and really gently dab with this beauty blender. I'm going to dab a tiny bit onto the eyelids as well, just to help hold the eyeshadow for when we get to that step. Okay. Have you angle your face towards me just a tiny bit. today, I'm going to be adding just a tiny touch of foundation just to even it out. We're not going to be using too much as your skin is so clear. Don't want to go too heavy. Okay, and we have a touch of this contour stick here. I'm just going to use really small amounts. I'm going to add a tiny bit under your nose as well. Just going to gently blend with the Beauty Blender. Now I'm going to go ahead and do your eyebrows. I'm going to use a darker color with this eyeshadow brush. For a nice subtle look. Just a touch of definition. Now I know you are more of a silver girly, but for the sake of experimentation, I'm going to try out a little bit of gold on you. First I'm going to start out with a slightly redder tint along the corners of the eye. Just blending in light feathering motions. I have this nice chrome color. I'm just going to gently dab on. I'm going to dust off a little bit of the gold shavings. these beauty bronzer to just clean up a little bit of the fallen sparkles. Some nice thunder in the background there. Andrea, I'm going to go ahead and do your mascara now. If you don't mind just looking down at that little tea bag there, I'm just going to sneak the end of this mascara wand right up next to your eyelashes. Great. Reach around a little far side. Okay, a little bit there on your cheekbone. I'm just going to rub that out. I'll go down for the bottom lashes. If you wouldn't mind just looking up at the ceiling. Great. I'm just going to cover up my little mistake there. Now I have a nice lip oil here as well. I'm going to ask you to just relax your lips. I'm going to just gently apply. Okay, you can go ahead and rub them together. Just going to add a little bit to the upper lip. Go ahead and rub together. Alrighty, Andrea, we're almost done here today. I'm just going to go ahead and finish off with some gentle combing of your hair. Okay, now I'm going to have you stand up and take a look at your final look in the camera. So here we have the final look. Let me lower the brightness here so you can see it a little bit better. We have a nice like accent on the lips, which is perfect for a date. We also went ahead and framed the eye shape how I initially mentioned. I went ahead and darkened your eyebrows just a tiny bit, just to help frame the face as well. And you are stunning. You're so gorgeous, and it was so much fun working on you. What do you think of your final look?
I love it. Thank you.
Yay. Okay, great. Thank you so much for coming in and having so much fun on your date.
Thank you.
Thank you. I'll see you soon.